The field of oncology chose me. Anybody who went to medical school with me would say, "Where's Gina Brown, the orthopedic surgeon?" I was a structures major in civil engineering. I was an athlete, so I was going to do orthopedic surgery, women's sports injuries as my focus, and I'm in medical school and my dad gets diagnosed with prostate cancer. 3 months after my father died, my mother got diagnosed with a rare sarcoma of the uterus. And 4 months after my mother passed away is when I got diagnosed with breast cancer. There was just a lot of instances like that that got me close to cancer patients and just what that is all involved. I use the experiences of what we went through as a family when I'm dealing with my patients on a daily basis. I put that same compassion and effort towards my patients as I would my own father or my mother.
Dr. Brown's patients love her, which is not a surprise. She really treats her patients like family. And one of the things Gina always does when she talks to her patients is she sits on the stool and she slides that stool right up next to the patient so they're knee to knee, and really has an eye-to-eye, heart-to-heart conversation. And it's actually a really beautiful thing to see. And she does such a good job of connecting with the patients, even from the moment she walks into the room. I think she sees her job is to offer the best medical care that she can, but at the same time offer an equal amount of support to the patient no matter what.
I get to talk to my patients and interact with them and share with them, and they share with me. And, you know, at the same time, our focus is on making them better and getting them back to doing the things that they love. And so a patient comes to us, they have a problem, we diagnose the problem, we figure out solutions for them, and then we see them get better. And if we can play a role in making that as peaceful as possible, then that's another aspect of my job.
Dr. Brown is one of the most down-to-earth and compassionate people that I have the privilege of working with. She is no nonsense and is real straightforward, is a straight talker, and people can understand and relate to her in a way that's, I think, really hard in this day of modern medicine. And she is incredibly compassionate and has real concern for her patients, really relates to them, really connects with them, that she's really concerned about them as people and not just as patients.
I've started the Regina Brown Fund to support our members of the armed services and their families. My parents being from Baton Rouge, Louisiana, the Air Force was the best thing that could have ever happened to my father. He was a career airman, retired as a Chief Master Sergeant in the Air Force. My siblings and I have enjoyed great success based on that. The bigger influence was my oldest brother. George was a cadet at the Air Force Academy when I was about 8 years old. And I remember saying that when I got big, I was going to go to the Air Force Academy because girls could go then. Unfortunately, he was killed in a car accident when he was a cadet, and that stayed with me in the back of my mind, and I was fortunate enough to have the right circumstances and be able to make that a reality. And so one of the things that I wanted to recognize are our patients in the armed forces that are dealing with cancer, or they have a family member that's dealing with cancer. I want to be able to have restricted funds for those service members or their families to give them the support that they need to get through their treatment. And so that is kind of what's near and dear to my heart.